Hi, my name is Tim Bale and I am co-director of the Mile Institute at Queen Mary University of London. Welcome to another in our series of videos about COVID-19. Today we're going to see my colleague and friend Sophie Harman from the School of Politics and International Relations at Queen Mary, discussing with Dr Annie Wilkinson of the Institute of Development Studies at Sussex the effect of COVID-19 on slums and informal settlements, and also discussing the strategies that could be used to help them. If you enjoy this video, please do share it and please come back for more.
Hello, I'm Sophie Harman. I'm a Professor of International Politics at Queen Mary University of London, where I conduct research into global health politics. COVID-19 is increasingly a very visual pandemic. There's a visual politics to it, as we see from the pictures around PPE to deserted ghost towns. But there's a particular international dimension that I'm quite interested in, which is this kind of interest and obsession with informal settlements around the world, or slums. And this got me to thinking about the relationship between informal settlements and COVID-19. So I thought, who better to talk to than Dr Annie Wilkinson from the Institute of Development Studies in Sussex, who is leading a project with SLURC, the Sierra Leone Urban Research Centre, on post-Ebola urban health, and knows lots about the subject of informal settlements. So welcome, Annie. Thanks so much for making the time. I suppose to start with, why are we so interested in informal settlements and COVID-19?
Yeah, good question, because I think it's been kind of amazing to see this like explosion of interest in informal settlements and slums, and real kind of concern and fear about what it could mean. I think that there was an initial kind of oversight that lots of the recommendations about socially distancing and washing hands, seem simple, but actually then when you start thinking about how applicable they are in places where, people don't actually have access to water, and they all kind of water and sanitation, they shared toilets, they're crowded, often quite crowded settlements. So then there was this kind of like realization that those apparently simple measures were not going to be possible. And I mean, this is a huge issue. If you think there is at least 1 billion or approximately 1 billion people that live in slums and informal settlements throughout the world who have really, really limited kind of infrastructure. But yeah, your question about visibility is also kind of interesting, because I think there is a kind of a popular imagination about slums and informal settlements, and that they are these kind of crowded, unhygienic places that are often framed as kind of vectors of diseases. So, in this case, it's not that the disease is coming from them. Actually, it's coming, if anything, from the kind of global north to the global south, but there is a particular concern about the vulnerability of these places. And I think that it plays into imagery about slums and hygiene and stuff like that. Some of that I think we can definitely like problematize, which maybe we'll get to.
Yeah, and I think that's a really interesting point, because it's sort of, like you say, there's a lot of myths around slums and informal settlements. I think some picture editors seem to be obsessed with Kibera in Kenya, either through views or, that kind of very visual, people very crushed into certain spaces. Does that really help with the response, or do you think it just feeds into this wider narrative of, these are vectors of disease, unhygienic spaces?
Yeah, I do think it is good that these contexts are getting attention, because I do think they were overlooked. But I think there is a problem when that attention is these stereotyped images of them. So a big thing is that they're not all the same. Slums and informal settlements are incredibly diverse. They're not all crowded, densely populated places. Some of them are actually kind of pretty, sparsely populated. And so we have to be really careful about not to make kind of overgeneralizations of this, and definitely the media kind of love a particular angle on this. So first of all is like that conceals a lot of diversity, which is really important to understanding like how to control the disease and what the different vulnerabilities are in different places. I think the other thing is that your interest in visibility is also kind of interesting, because around slums and informal settlements there is a lot of issues about how basically governments tend to really not have a very good data about these places and to not have a very good understanding of them. And often that's kind of deliberate because they are, by nature, but the nature of their being informal is often that they're kind of illegal, they're not supposed to be there, or that's the kind of government attitude to them. And so the government often kind of like, they don't collect data on them in kind of formal statistics, and they generally try not to engage. Sorry, I've got something just popped up on my computer. And so that means that basically, like, one of the points I've kind of made earlier on is, like, if you think about all the data that is going into controlling the disease in like richer countries and economies, all the kind of debates about modeling and everything, and we can argue about whether those are good or bad or whatever, but like that data about who actually lives in a particular area, what is the kind of livelihoods of people there, what are the underlying health conditions of people there, like that is in some places just almost non-existent, like we just don't know. And so that has real implications for mounting a response. But the other thing, your question about whether or not it's helpful, I think those stereotyped images are not helpful because they're incorrect or they conceal diversity, but they're also not helpful because they can imply that nothing can be done, that, you know, the disease is just going to go like wildfire through somewhere. And I think, you know, one thing we really have learned from like many epidemics now is that kind of like fear and messages based on kind of fear and this potential decimation are not helpful, and that more positive kind of hope-filled messages are better. But also because those are true, there are things that can be done. There's all sorts of kind of local like initiatives and organizations and that are already mounting amazing kind of responses in these areas and are going to be key to what's going to make it not as bad as hopefully it could be.
Yeah. So that leads to the question, what can be done based on your previous research and your current research?
So my first response to that is going to sound like a cop-out, but it's not. It's that basically it's not necessarily for me to tell or for other particularly external expert people to tell, to kind of decide what can be done. And really that there is no kind of one-size-fits-all approach, and it really does have to be kind of driven by the people that live in that area, that understand who is vulnerable in those places, who understand the kind of spatial environment, who know how to kind of think about, you know, where are the high kind of contact places, and how can they kind of come up with locally appropriate kind of mitigating strategies. So the first thing is to engage with local people and local organizations and really make sure that they are properly resourced and empowered and all of those kind of things that we typically we say, but we often don't do well. So that's the first thing. Then the other thing is that there are, from our research in Sierra Leone and on Ebola, like, again, there was similar kind of doomsday, like if Ebola gets to cities, it's going to be awful. And there were models that were predicting kind of millions of deaths. And in the end, that didn't happen, thankfully. And it didn't happen because there was an incredible amount of local social kind of behavior change and local organization. And, you know, a lot of that happened, again, in cities and informal settlements. And so, you know, whether it is kind of local task forces organizing kind of, in the case of Ebola, things like house to house, like basically local surveillance groups. So people would kind of go around identifying if there were kind of sick people, making sure they got to the hospitals, making sure they were reported. There was a lot of stuff about like movement control. So again, even in a kind of crowded informal settlement place, and this is where the point about the spatial environment makes a difference, there's going to be different kind of mobility patterns through places. So if we want to control movement, then actually you could have task forces that kind of controlled people coming in and who could come in, and, you know, that happened a lot with Ebola. And it might be that you can do similar kind of things with COVID-19. There are obviously differences between COVID-19 and Ebola, like they transmit differently and all of that. But again, there's potential for kind of locally organized responses.
No, that's great. Okay.
The other thing, sorry, really important to say though, is that it can't, even though I kind of am championing the kind of local response, that it can't only be that. there are also some really practical things that are happening, and that need to kind of happen at a kind of a larger scale as well. So, you know, the rapid scale up of water access, that's happening, whether it's kind of provision of little hand washing stations, or whether it's actually more kind of other kind of infrastructural projects being kind of rolled out rapidly, and that is happening. The other, I guess the other flip side to that question as well is also kind of what can governments and local governments do, what can they do that isn't helpful, and things like lockdowns, when you have people that live kind of hand to mouth, and, you know, basically lockdown and other kind of physically distancing strategies that basically it's kind of economically impossible for people to comply with. Unless they have kind of assistance. So I think governments need to be thinking much more about, like, how do they engage with the really kind of marginal actually existences of in some settings, the informal economies that people depend on. So whether that is things like cash transfers to people to enable them to be able to comply with control measures, you know, that's the kind of thing that could also be happening.
Thanks so much.
So much.
No, well, there's so much in there, isn't there? So absolutely. So context is really important, recognizing difference and diversity, harnessing knowledge that already exists there. So often people do actually know how to mitigate these, and it's about harnessing those with giving provision. And let's just not catastrophize that. This is having huge implications for everybody around the world. It's different in informal settlements, but all is not lost.